Arubah means restoration to sound health in Hebrew, and that word really captures what we do here, because it's not just about your physical health, but it's your mental health, your emotional health, your spiritual health. Hi, my name is Hillary Nicholson, and I am the founder of Arubah Community Clinic. Open a Free Clinic was on every page that I turned in the book Crazy Love. I haven't told this story in so long. Crazy Love, written by Francis Chan. As I was reading this book, it was on every page that I was supposed to open a free clinic. And the kicker to this was my goal, my dream, was to open a pediatric practice in Collinsville and take care of kids. And my husband and I had sat down and looked at a budget about 6 months before this, like how do you even open a medical practice and how much money does it cost? And well, it was about $600,000. And so we went, oh my gosh, like there's no way we'll ever be able to afford to open a practice. And so we just kind of let it go. So then as I'm reading this book and it's saying to open a free clinic, I laughed because I thought, well, how on earth do you open a free clinic? After a couple of months of wrestling with it, I finally thought, okay, I'm going to start praying about this and see if this is real. Years after we opened here, God blessed us and we were able to open a pediatric practice across the street. And so we've been over there for 8 years now. And so I consider that my gift from the Lord for being obedient in opening a crazy free clinic that I didn't even know what free clinics did. And so I view treasured pediatric care as a gift. And so as long as Arubah is here, Treasured will always be a huge contributor to Arubah. There are a few things that I love about Arubah. The first thing that I love about Arubah is the staff, because they indeed are the face, the heart. They are everything about Arubah. The second thing that I love about Arubah is the testimonies. Just when I feel that feeling of, gosh, I just want to walk away because this is just hard work, God brings a testimony and kicks me in the spirit.
While Arubah's doors have been open for over a decade, with the continued rise in healthcare costs, I feel that we're just at the beginning of what we are called here to do. My name is Laurel Malini. I am the nurse practitioner at Arubah Community Clinic. I have been involved with the clinic since the first night we opened in November of 2011. One of our continued goals here at Arubah is to improve on our diabetic healthcare plan. We aim to do that by continuing education, providing better access to medications, and empowering the patient to take control of their healthcare. What I enjoy most about working here at Arubah is not only being able to use my skills to serve others, but also developing relationships with my fellow coworkers and the patients.
Before Laurel, I had several other doctors. They usually don't listen to you. You're in and out, you know, they're not as caring. And she really, if I have a problem, she works until she figures it out and takes care of it. My name is Darylyn Salvatore. My job changed and I didn't have insurance anymore. And my whole family is diabetic, so I had been without medicine for quite a while. So someone actually suggested Arubah, so I came in hoping I could get my medicine prescribed, but
They've done more than that. They've helped me a lot.
I started on a Monday night, came in. I don't think I saw Laurel then. I saw someone else. And then they said, you need to be in the diabetic clinic, in the chronic clinic, and set me up an appointment. And they see me once every 3 months. So anyone that needs their sugar monitored, their heart, their blood pressure, anything like that, it's great to, come in and let them, take care of you.
We, in the next year, would like to gear back up to full-time, meaning we would be here Monday through Friday. That would require hiring some additional staff. We also need to hire a full-time executive director in the next year. And so I feel it's almost deja vu-ish because we've been here before when we were like, okay, is it time to expand? Do we have the money to expand? Are we where we're ready to expand? And we did it, and then COVID happened. And so it kind of set us back a second. But I think we're there again, and just being good stewards of the Lord's prompting, and as He takes us there, that's where we're headed. The need is never going to be completely met by Arubah, but God doesn't call us to fulfill the need. He calls us to just contribute and help with that need. Long-term goals would be to build a facility, have preventative classes in-house like diabetes education, exercise equipment offered would be huge. Just focusing more on the prevention of a lot of these debilitating diseases, because we can hand out meds all day long. But if we don't start at some point and teach patients or give them access to things that help prevent these diseases, then we're not fulfilling the calling that the Lord has given us completely. So that will require a bigger space. This space is perfect at the moment, but just as we look long term into the future, that would be a big goal that we would have. We depend on individual donations. And so, for example, we do have one donor who gives $10 a month, and that $10 a month is huge. It's very impactful. Events like this one tonight are big. This helps fund what we do here. You know, just some fun facts for Arubah. Over the last 12 years, we have averaged 2,000 patient visits a year for free. We have averaged a donation of $175,000 in pharmaceuticals to patients that can't afford it. We average $30,000 annually in free lab work. Your donation pays for those things. Your donation makes those things possible. We like to partner with big entities like Henry Schein helped us with our dental room. Those things make big things happen like that. Your donation, individual donation, month to month is what keeps this place going. Thank you for your dedication to Arubah. Thank you for spending 12 crazy years with us. Thank you to my family for their support all these years and continued support. But thank you to the donors and just those people that are behind the scenes that do continue to give. Your donation monthly is so impactful, and even you being here tonight is making an impact in our community and surrounding communities, and it's all for the kingdom of God.
Thank you, Arubah, for your quality care. You've changed my life.